Welcome to our first of a hopefully not too long of a series, but first webinar, Zoom webinar that we're offering to our members and beyond. We are going to be discussing today, as you know, that's why you're tuning in, Family Corona's Response Act. And we are just so grateful to our friend, our longtime friend, Attorney Charles Dunkel. Thank you so much for taking time to do this. We have, Charles is with Mills Shirley LLP. We have a 174-year-old relationship with Mills Shirley. They were one of our first chamber members, and we're just so grateful for all that they do. Not only are they just outstanding attorneys, but they give back just time and time again to this community and beyond too. So Charles, welcome. I think everyone has seen the itinerary. He's going to be covering paid sick leave law, the FMLA extensions, confusions that employers are having, and all of this information that are coming before us. And he's going to dispel some of those rumors about these laws. You guys, thanks so much. I just want to remind you that the Galveston Regional Chamber of Commerce does have a really good COVID-19 page on our website, www.galvestonchamber.com. Lindsay Touche, team member here, vice president of this organization, has done an amazing job. Lorraine Grubbs has set this up today. Thank you, Lorraine, for doing this. And y'all stay tuned for upcoming webinars that we'll be hosting. So Charles, with that, thank you so much, dear friend. We had a little conversation before. It's good to know that you and your family are well.
We're doing fantastic.
In the office because the kids are at home. So I'll turn it over to you, friend. Thank you so much.
Yep, the kids stayed home, so I ran.
So he ran.
Before we get started, Charles,
yes.
If I could just interject, anybody, we submitted all the questions that we had received prior to this webinar to Charles yesterday. And so he's had a chance to see them. If during this conversation you have any more questions, everybody should be familiar with the chat. It's on the right-hand side. And you just type your message and it comes up, and I'll make sure that if it's not something that Charles has already covered, that I give it to him after, at the end of the conversation. Thank you.
Hello, everybody. To those I know, hello. To those I don't, it's nice to meet you. Strange way to meet everybody. But hey, thanks for joining. I'm glad I'm able to participate and reach out to all you guys and clear up some confusion with the recent law and the recent law changes. We've two things. First of all, I know the camera's here, but my screen is here, so I'm kind of looking off the side. I don't mean to be rude, and that's not my intent. It's just, of course, I'm gonna look at the screen. There's some people on my screen and all that. So if it comes off kind of strange, I do apologize. I did rearrange my desk the best I could to get the camera and my monitor as close as I could. This is the best that came out. Anyway, we got an hour time allotted. I don't believe we're gonna have to use the whole hour, but if we do need that time, we have it. As complex as this law or laws seem to be, it's really not as bad as you would think when you get past the surface of it. During the course of my presentation, I will probably answer the majority of the questions that I received. I received some from the chamber. Some people sent me directly to my email. So I kind of know where everyone's coming from. And believe it or not, the questions I got that were sent to me yesterday is what's been being sent to me over the last 2 weeks. I mean, we're all in the same boat. Everyone's pretty much thinking the same. And so this is going to focus on what's called the Family First Coronavirus Response Act. Some of the questions I did get in were more of questions outside of our scope today. So I might not touch on those. A lot of those were just Employment 101 questions. But if we don't cover them today, and I'm not trying to be rude or ignore you, at the end of this, I'm going to give you my phone number here at the office. You call me at your convenience. If you catch me, fantastic. If not, leave a message. I would be more than happy to have those employment 101 questions with all you guys. I enjoy having those conversations. It's not going to cost you anything. Just call a lawyer. That sounds kind of scary to me, but I'm putting it out there to you guys. So if you want to call, just not today, next week, a month from now, a year from now, you want to call and ask a lawyer a question about employment law, I'm going to give you my number. You can get my email also, but I usually don't correspond with regards to legal questions on that, because there's legalities around me answering questions for technically not clients kind of thing. So I try to stay away from that. So, but my phone's open for you guys. What I want to cover here today really is to help you guys make sense of the Response Act, because once it came out, it seemed to be very confusing. I started hearing rumors. There was misinterpretation. I was seeing things on the internet that were so inaccurate, but I could see where people were coming up with how they were interpreting it. And because when it first came out and I was reading it, it was a little confusing for me too, and I've been doing this for almost 20 years. So I putting myself in a position where someone who doesn't practice law, someone who doesn't read statutes for a living, getting this, and it came quick, and we hit it hard, and we had to comply pretty quick. And to be able to be an employer and try to digest all that and say, hey, what do I do? Am I interpreting this right? And we all do this. We all run to the internet. We do our queries, and we read on there, and we hope that it's right, and we implement it. And the last thing we want is it to be incorrect, and then we get bit. When everything calms down, we're getting sued, or other type of complaints are hitting you. We want to avoid that. I want to help you avoid that. So I kind of put this together today, again, I hope it's beneficial. One thing that you need to know about the Act, it did two things. It extended what's called the Family Medical Leave Act, the FMLA, which I'll call it throughout the course, and it created what's called the Paid Sick Leave Act. It did those two things, and when it did it did it in a way where they're supposed to work together. And a lot of the confusion is, well, what goes in which one? Which one is under the FMLA? Which one is under the Paid Sick Act? And a lot of the information that you can get offline, they would say things like, if your situation is number 1 in 5 or number 1 in 6 over elements of containing 6 different elements, or number 2 and 3, it would say, see this box, see this is how it complies. And what an easy way to get confused. So I'm going to break the FMLA and the Paid Sick Leave Act. I'm going to separate them as we do this to make it a lot more simple to understand exactly what we have to comply with. Starting with the FMLA. The only thing that happened with FMLA was one thing and one thing only, with regards to broadening its scope. It just added another category, which is if you're not able to go to work because your child care or your school your children go to have closed down because of the coronavirus, or in response thereof. It just added that one little category. All the other categories are still in place for reasons needing FMLA. None of them were changed. None of them were affected. It just added that one reason for triggering FMLA. Now, there's a little more to it than that, and I understand that, but as far as different reasons to trigger FMLA, it only added one. Though a lot of the questions I was getting was indicating that you would think it added several others, and it didn't. It added that one. And to be eligible for that one, it came up with new eligibility thresholds, because again, the FMLA has not changed. All the reasons before that was in existence of why you can trigger it are still in place, have not changed. They brought in the new one. If you got to stay at home because you have nowhere to take your kid because the school closed down, because of the child daycare closed down, you can trigger it if you fall in the next category, which is you were employed with your employer for at least 30 days prior to the enactment. It went into effect yesterday. Yesterday, April 1st. Stays in effect until the end of this year, December 31st. So if you wanted to trigger it yesterday, you must have been employed March 2nd, 2020 at your current employer. The other thing it did is FMLA, which this has not changed. You have to have 50 or more employees in a 75-mile radius for the normal FMLA. That hasn't been changed. The new act, the extension of this changed just for this one element, just for your kid had no daycare, your kid doesn't have school. The new law is you can trigger FMLA for that one reason if if the employer has 500 or less employees, which pretty much means all of us, right? And of course, that was done on purpose. If you have more than 500 employees, this is not applicable. And I'm going to say that probably all of us who are listening here today fall under the 500 employees or less category. So it's going to be applicable. Now, if you have fewer than 50 employees, probably more like 30 or less, and you believe that this law being applicable to your company could close you down, then there is an exception, and you can request for that exception, which I'll cover a little later exactly what you need to do now in order to protect yourself, but which is definitely the Department of Labor doesn't want you sending them anything right now. But for the most part, this is applicable to everyone who's listening. And so if you have employees, if you have 500 employees or less, you have employees that have been, well, now it would be what, it would be March 2nd to today, and they want to trigger this FMLA because their kid can't go to school, or their kid cannot go to daycare because of the coronavirus. They can request it. Now, the other thing that the law did, expanding that, and which is a little different from the typical FMLA. If you trigger typical FMLA, you're not entitled to be paid. Now, of course, if you have accrued vacation, sick time, that can come into play. But normally, it's 12 weeks of unpaid sick leave, to take care of yourself or a loved one. What the law did, what the change with this, again, is just this one element. Just if your kid doesn't have daycare, your kid doesn't have school, and you trigger the FMLA, you're entitled to 2 weeks or 80 hours of pay. Again, that's only for the first 2 weeks. Now, if you need to extend it for the additional 10 weeks, for that one reason, the law does say that at that point you're entitled to 2/3 regular pay. There are caps. It's $200 per day, or an aggregate of $12,000 over a 12-week period. And that is all the FMLA has changed. That is it. Now, all the other stuff that you heard that sounds like it went in there, that's going to be the paid sick leave act, which we're going to spend more time on because there's more to that one. But again, that's all there is to this FMLA stuff. It's really not that difficult and confusing. Just to recap real quick with it. FMLA, before the change, as you know, there was it was for 50 employers or more, and an employee had to work for the employer for for 12 months, and you had to, I always have to look it up, you had to at least work 1,250 hours, which is, I think that equals 6 months over 40 hours a week for 6 months. Okay, and then you were eligible for it if you were sick, a loved one was sick, you need to take care of them. Okay, that's normal FMLA. No changes to that. The Corona Response Act expanded the FMLA again. Only one added the category. It added the category is I need to use FMLA because my child daycare is closed or the school's closed. I need to be home with them. They're not old enough to take care of themselves. And I've worked for you for at least 30 days And again, this is for both full-time and part-time employees, if I didn't say that. So I've worked for you at least 30 days. My kid has nowhere to go. I got to stay at home. I want to trigger FMLA. I want to first trigger the 2 weeks or 80 hours of my regular pay. And that's, again, even if you're a part-time employee. And if for some reason we have to extend this longer, we can't go back to the schools or daycare because of the coronavirus, I'm going to ask you, Mr. Employer, to extend me another week or 2 weeks, all the way up to 12 weeks at 2/3 my pay. Again, that's capped at $200 a day or $12,000 aggregate over the 12-week period. And that's it with the FMLA. And I hope that was not confusing. If so, when we get to question and answers, I will go over it again. But it's just that one category and those little elements. Okay. The other thing that the Family First Coronavirus and Response Act did is it brought into play the paid sick leave law, which has 6 different categories or eligibility items that can be used to trigger the paid sick leave act. Okay. And what it does, like the FMLA extension does, it provides for 80 hours of paid full-time period for the first 2 weeks. And for part-time, with regards to this, it's an average number of hours for 2 weeks over a 6 weeks period, which is another way to say it is you take your average of over a course of 2 weeks and extend that for 6 weeks, and whatever the total average comes out as a part-time employee, that's what you would be entitled to. Now, how are you eligible for that, to get that 80 hours of paid full-time? All right. This is where it kind of got crazy, and I'd get online and I would see these different charts and arrows going this way, going that way, and I got confused. And some of that, I will say this, I didn't see any of that on the Department of Labor, and I'm going to cover them a little bit at the end. This was just stuff that I don't know who was generating this information, but it was just so confusing that I guess the author had no problems following it, but the rest of us did. But you are entitled to request to pay sick leave law and the 80 hours of paid time. You're eligible for the following. A, if you're unable to work because you are quarantined pursuant to federal, state, or local government orders, or the advice of a healthcare provider, your doctor says, hey, you need to stay home, or you're experiencing COVID-19 symptoms and seeking a medical diagnosis. If you fall under any of those 3 categories, you're entitled to trigger the 80 hours of pay if you're a full-time employee, and again, part-time would be the average over 2 weeks over a 6-month period. All right. So again, I'm trying to get away from those charts that you're seeing out there. If you fall under one of those 3, you can trigger the paid sick leave act. Okay. Now it goes on to state that you can also trigger it for 3 more categories you fall in it. But if you fall under these 3 categories, you're only entitled to 80 hours of pay at 2/3 your regular rate of pay. So you can get your 80 hours, but it's not going to be your full regular rate. It's only going to be 2/3. And that's if you fall under one of these 3 categories. A bona fide need to care for an individual subject to a quarantine. Again, your loved one, your kids, you got to stay at home. I'm sorry. Number 2, you have to care for a child under 18 years of age whose school or child care provider is closed or unavailable for reasons related to COVID-19. And again, that's an example of how they're trying our lawmakers were trying to get FMLA and the Sick Pay Leave Act to work together. And number 3, the employee is experiencing a substantially similar condition as specified by the Secretary of Health and Human Services in consultation with the Secretaries of the Treasury and Labor. Now let me stop here for a second and tell you about this one. And I think this is the number one question I've been asked with regards to these different elements. And it's, what does that mean? Or could you give me an example? No one knows. I haven't spoken to anyone who understands number 3. And I'm in these chats with up to 75 attorneys that we all do this employment law stuff, and we've all said the same thing. What is similar conditions as specified by the Secretary of Health? Okay. My personal opinion is what they were trying to do is, if you don't fall specifically in one of the first 5 categories I've said, but you're really close, but you're not, that's probably a similar condition which you would probably fall into it. Now, if you fall into that category, you're like, I just don't know, I would advise you to make that call to the Department of Labor or the Secretary of Health and Human Services. Again, don't guess, and then at the end of this, when we're all back to normal, you got a complaint filed against you, or you're in litigation. So make that phone call. But I promise you that number 3 on that one, I don't know, guys. I don't know. So again, to get your full regular pay, if you fall under these categories, pursuant to federal, state, or local government order, advice from a healthcare provider, and/or experiencing symptoms from the coronavirus, and you're seeking a medical diagnosis. Second part, you're entitled to 80 hours of 2/3 of your pay if you fall under one of the next 3. A bona fide need to care for an individual subject to quarantine, pursuant to federal, state, or local government order or advice of healthcare providers. Or you have to care for your child because they're under 18, whose school or child care provider is closed and unavailable. And again, number 3, which if you're experiencing substantially similar conditions as specified by the Secretary of Health. And if any of y'all know what that means, please call me or do in the chat today, because I'd love to know, and I would love to at least share your opinion with other attorneys that we're all trying to figure that one out. I think even one attorney told me they did call the Secretary of Health and Human Services to try to get clarification. Person on the phone didn't want to give that clarification.
Didn't know either.
Okay, and now there are caps which regards to the paid sick leave law. It's up to $500 daily, an aggregate of $5,110 over a 2 weeks period if you're sick. So if you're sick and you trigger it, that would be the cap. It would be $500 daily, $5,110 aggregate. If it's because of child care or school closing, you're entitled to 2/3 pay up to $200 daily, again, $200 daily, and $2,000 aggregate over the 2-week period. And that's it. Now, of course, there's a little bit more to this law, but as far as being what we're doing here today and what you guys need to know going forward to keep yourself safe and in good compliance with the Department of Labor, that's it. That's the FMLA, and that's the paid sick leave act, and that's the differences. And I do hope that clarified. I know with regards to me separating it into the A and B and the paid sick leave law, which, to get full-time, the 80 hours, you have to fall into these 3 categories. To get at least 2/3, it's fall in these 3 categories. I hope that cleared it up, because I think a majority of my calls was with regards to that. There was such a confusion of, when does the 2/3 apply? When does the full-time apply? And I understood that confusion. I hope that how I explained it really does lay it out for you. Let me say this about the Department of Labor. A lot of employers, for whatever reason, probably because half the time they're dealing with them, it's not good. But they are honestly a great resource. They are a great resource for an employer, not just for an employee. And I know there's a lot of belief they're just so employee, just not true. I use them all the time, and their website is very user friendly. And what I have broken down for you today you can get there. They have fantastic charts there. Stay off the internet and these other. I even seen some newspapers from putting out charts of how to know which category when you get 2/3. I'm telling you, go to the Department of Labor, user friendly. And right now, because this is in the forefront of all our lives, when you get on their website, it's right there in your face. You can't miss it. It's going to say, click here for all this information I just laid out. And because what I was going to initially do was create a cheat sheet for you guys, but it's there already, and they did it way better than I could have. And I would advise you to consult visit your website, and don't be scared to pick up the phone and call them. It's amazing when I'm dealing with employers, and usually when I'm dealing with them, it's because they're in trouble. Something's happened. Department of Labor's in their backyard, and they want them out as soon as possible. And when I'm having these conversations with them, how did you get in this predicament? I listened to it, and I was like, man, that was a phone call to the Department of Labor with a satisfied and the situation you're in, and you would never have got here. And again, it's because a lot of employers just feel they are just Department of Labor so employee friendly, and it is, but it's employer friendly too. So believe me when I tell you, use them. They're a great resource. I've been using them for almost 20 years, and I'm not going to stop using them. And actually, I've been starting my day since this all came down. My day starts with getting on the computer, and I go straight to the Department of Labor website to see what happened when I was sleeping, or if something snuck through late evening I didn't see. Like I had mentioned at the beginning, I've been flooded with a lot of questions even before we came up with this idea of doing this webinar. Between those and the ones I got yesterday, I'm going to cover just, I think, would be the top 4 to 5 that I get a lot of phone calls about. Number one is this retroactive? Is the FMLA extension retroactive? Meaning, I heard about it 2 weeks ago. So one of my employees said, hey, I want to trigger this, so I let him. And now it started, even though it was signed, it came into effect on April 1st. That same employee comes back now and says, hey, I want the 2 weeks again of pay. Do you have to give it to him or not? The answer is yes, because it's not retroactive to 2 or 3 weeks ago. It started on April 1st when it was when it came into effect, not before that. And unfortunately, some employers did do just that. They allowed their employees to trigger it. They paid them for the last 2 weeks, and then the employees are asking yesterday, hey, can I get another 2 weeks? Unfortunately, they're entitled to another 2 weeks because it's not retroactive, okay? I get a lot of phone calls with regards to, Mike's showing up sick. He's at the office. He seems sick. I want to tell him to go I want him to go get tested, make sure he's not contaminating us. Look, the rules have not changed with regards to if you have sick leave policies in place. They still have to comply with your sick leave policies and use common sense. If you're sick, regardless if it's corona or not, if you're sick, stay at home. Nobody wants you around. Stay at home. But if you find yourself in that situation, you cannot just flat out go up to him and say, hey, James, go get tested right now. What you got to do is invoke your sick leave policy and say, apparently you're sick, sending you home. And what you can do as an employer, especially because what's happening is you can say, and you cannot come back unless you get a fit for duty from your physician or from a physician. Put the responsibility of whether that individual needs to be tested for corona or not on the healthcare providers, okay? So you cannot specifically say, you cannot come back with unless you have been tested for this. No, you just say you need to go home, apparently you're sick. Don't come back until you have a fit from duty from your doctor. Let the doctor decide if they have the appropriate symptoms that they believe requires the testing, okay? I have some questions about government workers, city workers, counties, things like that. This is applicable to them too. Now there are certain employees that are going to be in a different category, like police officers, fire department, things like that. If you're not one of those, then this is applicable to you. If you work at the city court, you're a clerk, these laws we just talked about is applicable to you. If you run meters, if you do administration for the city, this is all applicable to you. Again, that's the basics. When you start getting into, are you an essential employee? Okay, the game changes a little bit, but the majority of us are not essential. And so again, the general answer to our city employees, county employees, is this applicable to them? Yes. I doubt there's any federal employees listening, but if there is, this is not applicable to you. Y'all, the Fed employees fall under a different category. I believe it's Title II of the FMLA. This did not extend anything with regards to that. So this, if you're a federal employee and you're listening, thanks for listening, but this is not applicable to you. Real quick, going back to the Department of Labor, I meant to mention this. One thing you should do is they issued, I'm going to show it to you. I got it going on here. They issued a poster with employee rights on it. And I know that most of you are not at your offices, but if you do go into the office, go ahead and post it like you post all the other required. And I'm not saying it's required, it would behoove you to post it. And I got this off the Department of Labor website again. Get that, post it. And if you're not able to get to work right now and maybe you're head of HR, do yourself a favor and just email it company-wide. Email it everybody. Just so that no employee 3 months down the road, 6 months down the road, a year from now can never say, I wasn't aware of this. My employer never gave me any type of notice. I didn't see it posted anywhere. Regardless if we have to post it or not, avoid that. Post it. Make the Department of Labor happy if they ever come visit. And when they're looking at your posters, post that. Again, I just went to the Department of Labor's website. I typed in employees' rights poster, and there it just popped right up. And I think if you get on there, there's a little thing off to the side that says employee posters. If you click on that, I think it takes you to two categories. It tells you required posters and posters that aren't, but that they make and they want you to put up. Even the ones that are not required, I always tell my clients, put them up, put them up. I'm telling you, when the Department of Labor comes to visit and they see that you have posters up that are not mandatory, you make their day. The next thing you know, you got good friends and they're leaving your business with no complaints, no claims being filed on you or anything like that. So that's the majority. Oh no, I'm going to tell you about teleworking real quick. Two things first. If you close down your doors, you are not operating at all, then an employee cannot come up to you and say, I'm triggering the 80 hours sick time. No. If you're not in operation, you're closed, they're not entitled to it, okay? Now, if you are operating and you're having people working from home, like the majority of you probably are, telemarketing is telemarketing. I must want to buy something. Teleworking is not leave. They've got to be working. Now, do they need to work in the same type of shifts they work when you see them at the office? Do they need to be sitting, there for 2 hours, take a break, come back 2 hours lunch? No. You and them can get together and say, hey, work for 90 minutes, and then I have these other responsibilities because I'm here at home I need to take care of. And they can go do that, and then come work for another 90 minutes. However y'all want to arrange that, that is fine. And I would, and this is me just having some conversations with Department of Labor representatives. If you're having those type of conversations with your employee and they're asking, hey, I'm going to get my 8 hours in, but I need to do it, in this format, be lenient. Be lenient right now and let them do it, especially if they're at home because they have a child under 18 who can't care for themselves, and the schools are closed, daycare closed. compromise more than you probably normally would. And again, they got 24 hours in a day to do what works need to be done. So let them split their schedule up during that time. I would highly advise that. And I mean, and I think it's the best practice anyway right now, because this is not normal. This is not the normal situation that we're dealing with here. If you do send a telemarketer home, let me say, I want to make sure I said this right. If you have an employee that you need to work and they don't fall under any of the 6 elements I said under the Sick Paid Leave Act, and they don't trigger, which of course means they wouldn't even be able to trigger the FMLA, and you need them to be working and they're not sick, they fall under no category. They cannot argue with you, well, I'm at home, I don't have to work. They can, if they are slotted as teleworkers, the Department of Labor has said, and the representatives I've had on the phone talking to them have told me they are going to back up the employer on this one. There's no room for argument. They have to, and now if they are able to trigger the Paid Sick Leave Act or FMLA, because one of those categories, okay, different story, got to comply. But if they don't, and you need them to work, they can't be like, I'm at home, I'm doing what I want. I don't like your hours. No. Again, when it comes to the hours, try to work with them. But if there's certain hours that certain things need to be accomplished, no room for argument, the Department of Labor said. They must comply. And if not, then you follow your discipline policy that you would do if they were at work. And someone did ask me, and I'll throw it out there, why 2 weeks? Why 2 weeks for the 80 hours of pay and all that? And from my understanding, that is the quarantine period that if you think you've been exposed, those symptoms will surface. I don't know if that's true or not. It sounds good. So I've been asked that several times, so I thought I'd put that out there to you guys. But that's it. That's everything. That's the main questions I get. That's the breakdown of the law. I do hope I did not make things more confusing at all. Again, before we hang up, I'll give it to you now. My direct line is 713-571-4205. If we don't answer your question today, because we still have time left, or you're an introvert and you don't want everyone to know your question, that's cool. I'm here. You call me. If you don't catch me, leave a message. I promise I will call you back within a reasonable amount of time, usually the same day. It's very rare I let a phone call go the next day, but usually the same day. Good chance you will have to leave a message because my responsibilities aren't only here for the firm. I have responsibilities in Texas City too. So I'm kind of going back and forth. Job responsibilities, not personal. So if you don't catch me, leave that message. I promise I will call you back. Again, regardless if it's Corona related or it's just a general employer question. Love them. Every once in a while I get one that stumps me and I have to go do some research. So see if you can stump me. Don't hesitate to call. With that, I'll see if there are any questions.
Charles, there are a couple. I mean, there's a running conversation here, which I think you may be able to address.
Can I pull that up here? Let me see.
On your right-hand side of your screen, do you see your chat box at the bottom? It says chat.
Yes.
Okay.
I think I did it.
Up and it'll give you that box on the right, the running conversation.
Okay. Yeah, does everyone fall under the first condition of quarantine? So Southern County is under an order. I would agree with that. Now, again, you also would get into, don't forget, if you're an employer that you've closed the doors, you're not operating at all, then you don't have to provide that benefit to your employees. If you're an essential employee, which that's going to be between you and your employer, and of course, there's a list the government has put out what's considered what type of business falls under essential. But if your business falls into that and your employer says you fall on that, you still have to report to work unless, again, one of the other five are applicable. But no, I wouldn't argue with anyone to say, hey, all these, the president has an order, the governor has an order, and our local authorities have orders. I wouldn't argue with any of that. There might be some people out there that will. I will not take the position. I agree, yes. If they want to trigger it for the 5 reasons, that being one, I don't think I would fight with them. Is there a difference between being under a general quarantine order and having been identified as being exposed to someone in quarantine 14 days? I would say this, and I think that most of the attorneys that I've been dealing with have said that we're hoping that employees are being honest with their employers, and if they think they've been exposed, we're triggering the law. We're triggering it. Because I would want them to get quarantined and anyone else they've been hanging out with. So that's the position I would take on that. Because the only way you're really going to find out about that anyway is if they come forward and say it. And if they came forward with me, I'm telling you, I will trigger this. I would trigger the act, whichever, and the FMLA, and just keep them at home. Another thing you could do, and I'm not sure, it would depend on your business and more of the fact scenario situation is, they might say, hey, I've been exposed, but I don't want to stop working. So you just have them telework. And then if they start coming down with the symptoms, and you can say, okay, I know, because there's a lot of people that, we all know them. They come to work no matter what condition they're in. And you have to step in and say, hey, I can see you on the monitor when we're telecommunicating. You need to be in bed. You need to go to the hospital. I'm triggering this for you. All right. So, be proactive. Okay. I'm not sure if I understand. So which quarantine is the act referring to, a general quarantine or a personal one? It's going to be both. Again, it goes back to if you're showing symptoms, you fall under it. You need to self-quarantine. If you think you've been exposed to someone, again, we just covered that. I think you need to self-quarantine. I hope that's answering the question. Now, of course, if you are showing symptoms, please stay home. Don't go to work. There's a word for that for people who go to work no matter what. It's called presenteeism, I believe it's called. Presenteeism. They are present no matter what. So, hey, next time you're watching Jeopardy, and there you go, presenteeism. Person won't go home, packing up all over the place. Let's see here. Probably as of tomorrow, we want to make all full-time employees part-time. Is there an issue with that? What do we do? Okay, we do vacation time, sick time, personal time, still remaining. Oh, great question. Great question. I meant to cover that. First thing with just regular FMLA, part that has not been changed. Number one, because it has not changed, if you're an employee with less than 50, remember, the normal FMLA is not applicable to you. That has not changed. It's only this new aspect. It's not a new aspect. All right. So and I only said it to say this. If someone triggers the FMLA and they have the new prong, if they trigger the new prong under the new act, you cannot force them to use their accrued sick time or vacation time. You cannot. As in the normal FMLA, you can. That has not changed. So if someone came to you sadly and said, "Hey, my mom's sick. She has cancer, like that. I got to take care of her." You can, and they have a bunch of sick time, bunch of vacation time built up. You can still under that scenario require them to use up that accrued time. Now with the new part of the FMLA, you cannot force them first to use your accrued time, and then if they still aren't able to come back, then say, okay, I'm going to give you the 2 weeks pay per the new statute. No, you cannot force. They are entitled to that, to how the law is structured now with regards to the new category. So if they fall under, if they're home because of the coronavirus for the first 2 weeks, they get that 80 hours. then they can get the extension of the next 10 for 2/3 their pay. Can't force the accrued vacation and sick time. Hopefully, thank you for whoever asked that question and reminding me to say that. Great question. Was there any more? I'm not saying any more. At least, did I refresh my screen or anything like that?
I don't see any more either, Charles.
Okay. Well, let me look through my notes real quick and make sure I didn't forget what I really wanted to tell you all about. I get so excited talking employment law, I get carried away and I forget things.
Charles, you're doing a great, can you hear me? It's Gina. You're doing a great job. I know this seems simple to a lot of people, but a lot of people are still asking me about furlough. Can you just describe that to us?
Yeah, furlough is just a fancy way.
And a layoff.
Yeah, the furlough is just a fancy way of saying a layoff. There's different types of furloughs. You have furloughs where you're letting the employee off for an extended period of time, but you're still paying their benefits. You're still doing sick leave and all. I mean, health insurance and all that good stuff. Then there's furloughs where, again, it's just a nice way of saying layoff. Where they're saying, your job's here when we're allowed to return to work, but we're not paying you. We're not paying for any benefits or anything like that, and which again would open up a whole different subject today. But one thing you got to be careful about is the COBRA laws. If COBRA is applicable, make sure you abide by the COBRA notice when you let them go. Again, if you're furloughing and you're keeping up benefits except you're not paying them, the COBRA is not going to be in effect. And in both situations, regardless if it's a reduction in force because of this, or it's a furlough where you're paying all their benefits, both categories will be entitled to unemployment insurance. So they can and under that situation, you should urge them, hey, go file for unemployment. It's applicable under that scenario, all that scenarios. But furlough is just a fancy word. Unless unless you're still paying something for the employee, it's just a fancy word of saying your job's here when this is all when we're back to normal. But right now, I can't pay you. Can't afford to pay. Which unfortunately a lot of businesses are in, because a lot of businesses they said they did a furlough. They close their doors. They're not in operation at all. I mean, they have no income to be able to cover overhead, which of course would be part of payroll. And they called it a furlough, but it's a layoff. And because a lot of those employees aren't going to come back, unfortunately. Hopefully I answered that question.
Yeah, thank you. Lorraine, did you have other questions from our members?
No, I had already submitted those yesterday. Thank you.
Okay, well, again, I hope they answer everything. Let me give my number one more time for everybody. 713-571-4205. Don't be scared to call me. I'm not going to send you a bill. I promise. I field phone calls all day long. I don't mind it. Sometimes it takes me a little while to get back to you. I usually get back the same day. Don't think you're inconveniencing me in any way. I make time every day for the community phone calls. And believe me, with regards to people like, why you do that without no cost? If you get in trouble and you need me, well, then
hopefully you'll call.
That's when the cost comes into play. But I don't want y'all to get there. I don't want you to get there. Call me. I don't want you to get where I have to be billing.
Charles, thank you so much. I've worked with Charles for, 18 years now at the Galveston Regional Chamber of Commerce. He's our attorney. I think Maureen Patton is on this call too. And we're big Charles Dunkel fans. We're in the fan club. So thank you so much again.
Yes, Maureen is not scared to call.
Maureen will call, and so will I. And so thank you so much.
You're welcome, everybody.
For all you do. We appreciate you. Thank you all. Keep watch out. Go to the Chamber's website to our COVID page. We'll have some other upcoming Zoom webinars, and so stay tuned. I think we're going to have our bankers on, right, Lorraine, next week. We're going to be talking about loans. We're going to have our Congressman Randy Weber. We'll be doing a town hall with 6 of our other county chambers. It's a partnership. So stay tuned, go to our site. We are updating this ever-changing information. So make the best of this day. Thanks you so much. Those of you that are members for being members. And Charles, thank you so much.
Oh, you're more than
Appreciate
welcome.
you for taking your time. We may come back to you with other
Absolutely.
issues.
We can do another one if need be.
We've also recorded this session, so we'll figure out how to get that out to our members.
Yeah, and here's our information for those of you watching this on Facebook Live. So thanks so much. We appreciate you. Thanks, Charles.
Oh, you're welcome. I'll take care.
All right.